We're ready. A brief interruption there. Well, what Melissa felt was anything that may be hurting a horse. We're talking about the threshold of pain. And if you have a high threshold of pain, these horses really don't feel any sharp teeth, and you won't have a problem on the bit or with a horse chewing. Yet, with a low threshold of pain, a horse can really feel these things and start throwing his head up, especially if you put pressure on the bit. Also, as they get older, if their tongue can't move around the mouth because there's something sharp that they're avoiding, their tongue can't clean the teeth. It's so important for the tongue to clean the areas between the teeth and on the edges between the tooth and gum. It makes a big difference in these horses as they get older. As you see a horse get to be about 25, they start to run out of what's called the reserve crown, or the part of the tooth that's underneath the gum. As it wears down to nothing, this tooth starts to get loose in the socket if it's not stimulated properly. I've taken some older horses that have loose teeth that kind of wiggle right in the mouth, and I've been able to remove the sharp points, let the tongue get around them so that it stimulates it, and allow the horse to bite strongly and firmly on the tooth, and it helps actually strengthen the tooth in the socket. These horses go on for many, many more years afterwards, just removing the pain. And that's what we try to do with this dentistry. We remove all sources of pain. There are some dentists out there who look at balancing of the mouth's movement from side to side, which is called lateral excursion. And what we find is every horse has a different way of chewing, and we're not here to correct that, especially if they're older. We don't want to change anything, just like we wouldn't want to change a crooked-legged horse after a certain age. It puts too much pressure on them. So what we do is we just take the pain away, it allows the horse to chew comfortably. Once it starts chewing comfortably, they will fit into what I call their own groove. So their teeth will line up, and actually it's almost like they're wearing braces. Their teeth line up straight and solid after about 2 or 3 years of floating. What Melissa uses right now is a very long float that gets to the very back of the mouth, and it allows, the grit is cut in one direction, and we believe in what's called the place and pull technique, where we place it and we sculpt the tooth down exactly where we want it, which is a little bit different action than a grit or a mechanical process that's constantly moving back and forth or spinning. That tends to just grind the tooth down without realizing what's being taken down. This way we can sculpt the mouth exactly the way we want it. As she goes on, you're going to see that she's going to place her hand in the mouth and the blade at the same time. So the hand and the blade, the hand is guiding the blade and is putting it in particular spots. The biggest thing to notice is we don't use the speculum. The speculum is the device that opens up a body part. Most women know about the vaginal speculum. Surgeons know about the abdominal speculum as they're doing abdominal surgery. And this is an oral speculum that's used in humans as well as horses. We don't use a device made out of metal. We actually use our hand. You saw Melissa stick her hand in there the first time. That device opens the mouth up and allows us to feel what we need to feel. The other thing you're noticing is that the horse is pretty much left alone. We don't drug the horse. Most horses, and I mean out of the last 10 years going back, the statistics show over thousands and tens of thousands of horses that we drug about 1 horse in every 10. In other words, every 9 horses goes without drugs. And here's a good example. The horse's head just came down. The horse comes to Melissa because we're removing pain. And the horse understands that we're here as a friend and we're removing these sources of pain. At first, the horse may bring its head up like that as we reposition. We call it avoiding the process, but they love the results of the process. So when she gets done with this particular stroke, and the float blade comes out, she may turn around and stick the float in the water. You notice that the horse isn't running away, the head's coming down, the lips are licking, and there's no real anxiety in this horse. In fact, and see how the horse just came up to her and just touched her? This is a perfect example of using horsemanship skills to do some of the veterinary work. And this is so cool. This is what we live for, actually, in our practice. We actually know when we go to bed at night, we've helped so many horses. So I won't say too much more. We'll just let Melissa work a little bit here. And if I see something that's going on, especially as her hand goes in the mouth, we'll talk about it. I'll talk a little bit about the front teeth as well as she gets there. What I like about showing Melissa working is this proves beyond a shadow of any doubt that it's not the size and strength and the force, but it's actually the technique and attitude that makes a difference when working with a horse. This horse has totally accepted Melissa for what she's doing and who she is. And there's no fighting or struggling. Now we do get horses that fight and struggle because there's pain. And on occasion, a horse will have so much pain that we need to administer some painkillers. So we use a combination of drugs to remove pain, to take away some of the tension, and on occasion, if there's any anxiety or fear from something that's happened in the past, we'll administer a third drug. And we use specific combinations of these drugs for each horse and individual horse. It's not automatic or routine. Every horse gets this dose. I think this is really important to understand that the science of dosing a horse properly. So for the horses that we do drug, it's basically painkillers. It's morphine-like drugs that allow the operator, the dentist, to get in there and actually take care of the part that's causing a problem.